Hey guys, it's Hina Sheth here at Rebalance Physical Therapy in Center City, Philadelphia and Narberth, Pennsylvania. And today I want to talk to any of you who may have had a C-section and are starting to develop issues after having your C-section. So what issues can come up? Well, everything from hypersensitivity of your abdomen. So I've had some people basically say that everything from putting their pants on and having pressure of their underwear or to the pant line, or even something as simple as just even their bed sheets kind of moving over the scar is creating sensitivity. Or actually some people will start developing pain with intercourse even after having a C-section, even though you didn't have a vaginal delivery. Some people will start developing back hip issues, and some people may even develop GI issues. So constipation, feeling like they have something called slow transit or something like that. So sometimes any of these 4 issues, but even more, can develop after a C-section. And sometimes if you go and see your healthcare provider, they may not quite understand what's going on, or they may say, let's wait and see, and nothing's really either done about it, or maybe you do go see a specialist, but they don't see anything going on either. So I'm here to talk to you today about complications after having a C-section and what can be done. And then we'll actually end up having some more videos on those specific topics. So I'm just going to kind of go over them briefly. And then if you want any specifics, then look for our other videos that go into the more specifics of C-section for scar, C-section with constipation, C-section, blah, 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 because there can be so many different complications. So in general, most people think, okay, C-section, it's going to be a tiny little scar, it's going to be fine, and the baby's going to come out, and I should heal fine up to 8 weeks. And that's what most women are told. However, many people can develop complications after having a C-section because it's a major surgery, and people don't realize that. I myself didn't even realize how much of a major surgery it was until I myself had it done to me, and then I had to go through the experience of what it was like to rehab myself. And even now, 2 years later, I'm still having changes with my body after having a C-section. And so basically, what they do when you're having a C-section is, I don't have the full model, but basically if you look at this is the model of your pelvis. These are the 2 pelvic bones. Here's your pubic bone. In the back is your sacrum, which is a low part of your low back, but part of your pelvis as well. And then the abdominals kind of come down from the rib cage, which would be up here, and it comes down and connects, the abdominals connect down to the pubic bone as well as to these pelvic bones. But what happens is they basically cut through the bottom part of the fascia of the abdomen, okay, way down low over here. So most people think, oh, well, they're just going to cut down here, it'll be fine. They're not actually cutting through the musculature. However, this is still part of what's called the fascia of the abdomen. So the abdomen turns into a certain type of tissue called the fascia, which actually inserts onto the pubic bone. So when you cut through that layer, and then they have to go fairly deep, because remember, you're having to go through not only adipose layer, but fascial tissue and other tissue to get down to the uterus so that they can take the baby out. So that's a pretty thick layer, and then they have to actually retract all that layer up in order to take the baby out. Well, this is trauma to this area, and people don't realize. They just think, hey, some people, I don't want to say all, but some people just think, hey, it's just a minor incision and the baby comes out. But it's a pretty darn, I don't want to say complicated, but it's a pretty invasive surgery when you're having that done. So now, after the baby comes out, you have to basically bring all that tissue back together, and then they basically suture the fascia up. But it doesn't automatically necessarily come back and go back to its normal form after you've recovered after 8 weeks. So this is where, most people are told, hey, just go, you can lightly start to walk again and go back into your everyday activities. But you can have complications of that scar, not only the top part of that scar that can become hypersensitive, but even deep down into those layers. And behind that layer is the bladder, okay? So you have the bladder, which sits right here, which is right behind that pubic bone and underneath the abdominal, and then you have your uterus. So some people, if they form complications at all with excess scarring, then you can become hypersensitive, and then that can also affect your bladder. It can affect the other organs, such as the intestines that are around it. It can then pull on other tissues of the pelvic floor. So if you look behind this, so again, here's the bladder, there's the pubic bone, the abdominals come here, but the abdominals actually, that fascia kind of spreads down and actually intertwines with the pelvic floor, which is all through here. Okay, these are the muscles that you often hear people do Kegels with. But if this becomes tight, and this is tight because of scarring or things like that or complications, then you can develop pelvic floor issues, which can lead to pain with intercourse as well. So I hope that just helps for you guys to see how things might be interconnected and how you can develop complications after a C-section. And hopefully if you're watching this video, you probably are not one of the ones that are having issues after a C-section. So I'm assuming that you might have some things going on similar to what I'm talking about, including, like I said, low back pain or hip pain, because again, a lot of the abdominals support the low back. So if you don't have good abdominal tone, or it feels like things have changed since then, that's going to play into low back as well as into the hip musculature and the sacroiliac joint, which is actually this low part of the pelvis, as well as even maybe the pubic symphysis or pubic bone pain. So a lot of these things can develop for some of you, and there is treatment that can be done about it. There's lots of different things that can be done. You can work on the scar, you can reduce the hypersensitivity around it. There's certain types of techniques, at least here at Rebalance Physical Therapy, that we do to improve the scar mobility, which can then help decrease issues, GI issues, constipation issues, improve any pain that you might be having with intercourse, low back issues, sacroiliac joint issues, hip issues, and of course any, like I said, sensitivity or issues around the bladder that could develop over time. So I hope that's been helpful. If you live in and around the Philadelphia area, it's a no-brainer. Come see us. We do a full kind of holistic evaluation for our postpartum moms as well as our peripartum. And we can help you kind of get a lot of this under control. And a lot of this is musculoskeletal. Typically, it's not something organ related, especially if you've already been checked out by a healthcare provider and they can't figure out what's going on. If you want additional information, you can go on our website, which is rebalancept.com. That's REBALANCE.com. I hope you guys have a wonderful day and talk to you soon.